I'll be talking about schizophrenia. I'll explain its symptoms, the diagnostic criteria, as well as the treatment. Basically, schizophrenia is a severe chronic brain disorder that disrupts thinking, behavior, and the mood of anyone that is having the symptoms. What are the symptoms of schizophrenia? For broad purpose, we are going to be breaking it down into positive symptoms, negative symptoms, and the cognitive symptoms. I'll repeat again. Let's do it that way to make it easier to be able to identify that in the exam. What are the positive symptoms? We can give examples of hallucinations, delusion, as well as bizarre behaviors. The negative symptoms, those are the A's. We classify it as the 7 A's of schizophrenia, and that is under the negative symptoms. The anhedonia, which is the inability to feel any kind of something that is pleasurable before. Avolition, patient lacks motivation for goal-directed activities. Patient has apathy, they don't have interest in doing anything. Ambivalence, you see them having affect incongruity, which is when they have a diminished emotional response. There's going to be alogia, where there's a reduce in the expression of their speech. Asociality, which is social withdrawal. Don't forget all the 7 A's of the negative symptoms of schizophrenia. These negative symptoms is actually the reason why they experience a high decline in their functioning. Then lastly, we talk about the cognitive symptoms. This is when patients present with memory and attention problem, and they also have poor decision-making ability. How do we diagnose schizophrenia? Using DSM criteria. So the person that has schizophrenia will at least have 2 core symptoms from all these 5 symptoms I'm going to mention. Delusion, hallucination, disorganized speech, disorganized behavior or catatonic behavior, as well as negative symptoms. As long as patient is having 2 or more from all these 5 that I've just established, I'll repeat them again. 2 out of these 5, more than at least 2 of these core symptoms must be presented by that individual. Delusion, hallucination, disorganized speech, disorganized or catatonic behavior, as well as negative symptoms. So let's now delve proper into the diagnostic criteria. I'll start with the core symptoms criteria. I've established that patient must have at least 2 symptoms from these 5 symptoms, and all these 2 symptoms is going to be presented for a significant period, at least for 1 month, and it can be continuous up to 6 months. So what are those 5 symptoms? Delusion, which is the false belief despite an evidence. Hallucination, that is when the patient is having a false perception without any active external stimulus. You see them having disorganized speech, incoherent or a loose association or tangential speech. The patient will be grossly disorganized, presenting with some catatonic behavior, something like unusual posturing or lack of movement. And lastly, they will present with negative symptoms, which have established all the 7 A's, just to further emphasize what I've explained before. The next criteria is the functional criteria. Don't forget, we want to diagnose the patient using the criterion platform. So the functional criteria, basically, patient will present with a marked impairment in work, problem with relationship, and they will not be able to attend to their hygiene. The third criterion is the duration criterion, which is the criterion C. Patient will present with all these symptoms for at least 6 months, including the fact that at least 1 month of active symptoms in the criterion A that we have established. The exclusion criteria also is the 5th one, where we have to rule out some symptoms that some patient can present with some signs and symptoms that looks like schizophrenia, but they are actually not having schizophrenia. So we still have to look at the exclusion criteria, which is the criterion D. And what are that? The symptoms that we have to rule out, or some conditions that we have to rule out, which is schizoaffective disorder, bipolar or depressive disorder with psychotic symptoms, or any forms of substance abuse disorder. And lastly is the exclusion criterion, which is what? The criterion E. We want to rule out any form of substance abuse or any other medical condition that may mix schizophrenia signs and symptoms. How do we treat schizophrenia? Basically, we want to start with the use of antipsychotic, which is, I'll just give an example of risperidone. I have a video that I discuss the antipsychotic, the 1st generation antipsychotic and the 2nd generation antipsychotic. Please log into that video and you can get more information about that. Since we are just talking about synopsis of schizophrenia, I'll just say antipsychotic, an example is risperidone. We can also use psychotherapy in form of cognitive behavioral therapy, or psychoeducation. We can also use family therapy, where family comes together and we all make a decision on how to help the patient. We also want to go by the support group for the patient. We also want to use psychosocial rehabilitation in form of social skill training, as well as the assertive communication community treatment, which is the ACT. What is the treatment approach? Our treatment approach is the recovery model, and this focuses on empowering the individual to live a meaningful life in their lifetime. So you want to note that this is just an highlight to schizophrenia, the symptoms, the criterion to diagnose it. For you to have more detailed content, kindly visit our website for registration at www.advancednpcertificationreviews.com. I'll repeat that. This is just a little bit of a tidbit of what you are expecting. For more detailed content review, kindly visit our website for registration at www.advancednpcertificationreviews.com. You can call my number or send a WhatsApp message directly to 281-372-9148. Thank you and God bless.